So there is something called platelet-rich plasma, and that's fairly descriptive of what that is, and it is entirely an autologous therapy. But when it comes to bone marrow-derived cells, there is a term for harvesting bone marrow-derived cells and then processing them. The colloquial term for that currently is bone marrow aspirate concentrate. BMAC is descriptive. It's also, I believe, patented, and Scott might be able to help us understand the implications of the term BMAC in terms of copyright or trademark determinations. But as we think of this as clinicians and as scientists and as patients, what is the accurate way to describe autologous bone marrow derived cells that have been processed in some way? Is BMAC an appropriate term to use? Should we be calling these cellular therapies? It's very common to see people refer to these type of therapies as stem cell injections. And I'm interested in comments. And I might first start with you, Scott. Where do you stand in this description, and what's the right way to educate people? Scott Bruder, I should say.
Yeah, we should clarify whether it's.
We got two Scotts.
Yeah, we got two Scotts here.
I didn't realize Dr. Bruder.
Yeah. Okay. Well, thank you for that setup, George. I think when we talk about this kind of therapy in the field and with our colleagues and with patients in particular, we should not refer to this as a stem cell therapy. It's not a stem cell injection. And I think the way to think about it is you can call it a biologic solution. And I integrate my answer based on regulatory feedback, on FTC feedback, and what is going to be easiest to navigate as a clinician. I think stem cells are hot and sexy and very, let's say, they have a tremendous appeal in the patient population, and they come in and they ask for a stem cell therapy. I think we have to be very careful and not talk about stem cell therapies, because even though we know there are cells that could be characterized as stem cells in bone marrow aspirate concentrate, it is a slippery slope and a dangerous position for clinicians and institutes to be advocating and promoting the use of stem cell therapy, because there are no stem cell approved products in orthopedics. I like the term BMAC. I like the term biologic solutions. I like the term tissue-based biologics and intervention, but I'd stay away from stem cell injections.
Maybe Chris Joe can comment. Chris, from your in Korea, where the regulatory environment is different and you have the ability to at least do some culture expansion, what are your thoughts on using the term stem cells to refer to these cell therapy preparations?
There's just some similar situations in Korea too about the terminology, and in some clinics who uses stem cells. Actually cells are not stem cells, but you use the stem cells. So we are going to correct this situation in Korea with some kind of medical society, and simply we'll try to call it BMAC as just bone marrow cells, and adipose-derived stem cells just as fat cells or adipose tissue cells. It's in Korean, 지방세포 and 줄기세포 and 골수세포. So it's very important for us to know that, to tell people, their patients, that they are different. We are not talking about that stem cells are superior to BMAC or SBF, but it should be told that those are different cells. Not only different, the nature of BMACs are made through the hospital procedure, and stem cells are drugs with FDA approval. They are different population production, they are different qualification, and different responsibility for manufacturer and the physician. So besides the effects, they should be noted they are different. And I think another different thing is to tell and educate and communicate anyway that let physician know that they are different. So use correct terms would be more important to terminology itself. And most doctors do not know the difference between cells and stem cells and BMX and BMX SVF. So it's important to let the physicians, clinicians know what the difference is, and do not tell the stem cells, and because the stem cells are too fancy term for patients. Yeah, that's it.
Thank you.
Thank you. I don't want to get too stuck on our very first question, but to Scott's point, even though it is possible that a stem cell is present in bone marrow aspirate, and there may be endothelial progenitors, there may be hematopoietic progenitors, there may be connective tissue progenitors, they're the least common cell in that preparation. And so it's extraordinarily bold to suggest that we even know that the stem cell might be the active ingredient. And it also, I think, as my understanding is, it's a violation of FDA regulations that would make claims that there is a stem cell that's acting. And so I certainly agree with Scott that the idea of getting rid of the term stem cell, it's being misused as a marketing tool. It projects a sense of knowledge that we just don't have, and a sense of enthusiasm to patients that really probably shouldn't be attached to these therapies. I do call these cells, these preparations, a cellular therapy, since cells are what we're concentrating, and cells are what are the focus of what we're delivering. And I don't know that falls outside of the range of FDA regulations. So I'll just pose two questions to anyone who wants to answer. One, is it wrong to call these even cellular therapies? And then two, Scott, you may know this, but the term BMAC, bone marrow aspirate concentrate, I think is trademarked by somebody. Does that limit anybody's use of the term?
Isn't that a Harvard term, Scott? Harvard
term? Scott Bruder.
Yeah, I'm not sure that they've trademarked that. I can check in online here and see if they've trademarked that. They've trademarked the names for their devices, like their smart prep system, right, which is maybe different than the tissue that results from the use of the device. And I think if you call it a cellular therapy, you're right on the edge. You're right on the edge of what I would guide from a regulatory compliance standpoint. There are cellular therapies that are Section 361 compliant for minimally manipulated and homologous use. There's a question. And I think the FDA's position is that the introduction of bone marrow into the joint space is not considered homologous use of bone marrow. There is no cleared or approved language around the use of bone marrow, BMAC, call it what you want, cells and tissues derived from marrow into the joint space. That's not regarded by the agency as an approved use and a cleared indication.